Thanks, Sue, for that lovely introduction. And yeah, we're going to move on, I suppose, very nicely from Anna's lovely presentation there. So just to take it back a couple of moments before the birth and thinking about the baby on the inside in late pregnancy or in labor, and thinking about the experience that they have for all their senses. You know, it's quite dark, they haven't got a whole lot of space, it's obviously very wet, and they experience gravity very differently. It's really noisy, but those noises are muffled, white noises, sounds of the body, of the digestion, of the heart rate and all of that. They're kept at a lovely, constantly warm temperature, never experience hunger, and have lots of lovely movement all of the time. And then we have that lovely moment of birth, and everything changes with all of their sensory experience. So when we think about what Anna's presentation was showing about the environment, that when we focus on creating a nice birth environment, it also helps with a nice environment for the baby when they become earthside, because otherwise it can be quite bright. They experience all of a sudden their arms and their legs have all this space to move around, but they don't have great control of them. They get dried. It can be quite noisy if we're not thinking about the noise levels, and those noises are different. They're much sharper. They'll experience that cold sensation, even though the rooms are usually very warm. You know, once the wet in the skin and the air is going to feel a little bit cold at first, and over the first day or so they'll experience hunger for the first time, and that sensory experience of having clothes on the skin. So looking after the birth environment for the mother also looks after the birth environment for the baby. But then what else can we do to help with that transition for the baby? So we know that skin to skin is ingrained in all of us. It's what happens in our hospitals and in our birth spaces. And it activates the sensory feeling of the baby on the mother's skin, activates the oxytocin release in both the mother and baby. And it causes the uterus to contract, which can reduce bleeding, but also gives them both a really nice sense of well-being, and warms up the mother's chest to heat the baby. So we have less hypoglycemia, less babies getting cold, and everyone's feeling a whole lot better. So that is why we protect that golden hour as much as possible in our birth spaces. We want to keep those moms and babies together. We want to keep them warm, and we want to keep that uninterrupted skin to skin time. And you can just see the happiness in these beautiful babies and their mummy in this gorgeous photograph, and they just look so delighted with life, and not at all distressed after going through that major transition of being born. They look absolutely happy in themselves. So that golden hour is there to protect the mother and baby attachment, to reduce stress in both the moms and babies. And what it does is it encourages the baby to have their innate breastfeeding behavior, their breast-seeking behavior. So hopefully many of you have seen that breast crawl where the baby looks for the breast and makes their way up. And the research has shown that giving this skin-to-skin time and protecting this skin-to-skin time facilitates successful breastfeeding, but it also helps the mother and the baby become more socially interactive. So they get to know each other a lot better by having this experience. Because when they have that skin-to-skin experience, oxytocin is released. And having looked at that lovely video of Hannah, you could see how she was awash with oxytocin after that lovely vaginal birth. And it's because of all the sensoriness of passing through the birth canal. And the baby's also really awash with oxytocin as well, because it will have passed through the placenta. So they're both primed and ready for the oxytocin, for falling in love with each other. And then when they have the skin to skin and then the baby latches to the breast, that suckling triggers more oxytocin to be released in the mother's brain, which leads to that milk ejection reflex and releasing the milk. But the suckling also triggers oxytocin release in the baby's brain, which enhances their metabolism and reduces their stress, and their cortisol comes down, and they start to feel much more relaxed, as we saw in those lovely twin babies in the photograph earlier on. And babies who have the benefit of skin to skin do breastfeed better. Their natural responses are quicker to come about, they root more, and they continue nursing for an average of 6 weeks longer. So really, really protecting that oxytocin and golden hour, in particular for the babies and the mothers who might miss out on the physiology of birth that Anna described, because they have less oxytocin naturally in the body because they might not have had that sensory experience. And so being able to protect that space for them is even more important. Just to kind of look at a few statistics for a moment, in Ireland, where I'm based, last year, we have very low breastfeeding initiation rates in Ireland compared to the rest of the world. They were even a little bit lower last year. But then when we look at our exclusive breastfeeding rate and discharge, that had gone down so much from the babies who had their first feed as breast milk. When we bring in combination feds and babies who are leaving the hospital, this is 2 or 3 days later when they're actually being discharged from hospital, it brings it back up to about 58%. So you might say that's only a 4% drop between babies who get their first feed of breast milk and babies who leave the hospital getting no breast milk. But that 4%, as a statistic, might not seem a huge amount, but it equates to over 2,000 mothers and babies. So over 2,000 mothers and babies who, most women who give the first feed as breast milk intend on breastfeeding. They weren't planning on just feeding once. So there's probably 2,000 disappointed mothers and 2,000 babies who don't get the benefits and the physiology of breast milk that it's going to help them for the rest of their lives and the rest of their health. So what's happening in that couple of days where we have 62% initiating breastfeeding, but only 58% leaving, even with some breast milk? So for me, we need to think about skin to skin beyond the golden hour and think about it as a much more long-term intervention. I love this quote from Dr. Tiffany Love, who talks, who just explains, that oxytocin isn't just milk injection. It's not just uterine contractions, and it's not just stress reduction either. It's a neuromodulator that can shape human social behavior. So it helps with the social interactions between the parents and the babies. And breastfeeding is probably the easiest and most important source of ongoing skin-to-skin contact, because every breastfeeding session will have some level of skin-to-skin, even if it's not full on the chest, skin-to-skin. We're going to have the cheek and the breast being in contact with each other. So breastfeeding will continue to help with this oxytocin release and with this social behavior and with the parents and the babies developing their relationship. But it's not just for lactation, and it's not just for the breastfeeding parent. While all of these oxytocin acts are enhanced by the breastfeeding relationship, they're not exclusive to it. So oxytocin acts on the dopamine receptors in the brain, which activate our reward systems. So when babies are kept skin to skin, it's activating their reward system, it's activating the parent's reward system. And the more often that's activated in the early days, it primes both the parent and the baby for being able to react positively to oxytocin every time it's experienced. So every time there is skin-to-skin contact, it makes that triggering system much easier when it's happened a lot in the early days. Our oxytocin levels are elevated in response to touch, warmth, and positive relationships. So it's like a positive life cycle. The oxytocin makes everyone feel warm, have that touch, and builds a positive relationship. And then it builds on that again and builds on that again. And it has the ability to influence behavioral responses by increasing the prominence of social cues. So in experiments where mothers were given more skin-to-skin time, so beyond that golden hour where they were encouraged to do skin-to-skin frequently over the first couple of days and weeks, they found that the benefits can last up to 9 years around social competence and stress reduction. So for those babies and those parents, those benefits can last a really, really long time. And it also helps to improve the detection and classification of positive social and emotional stimuli. So when the baby and the parent are having a positive situation with the cuddles and with the skin to skin time, but it can also blur negative experience or stressful experiences. So the oxytocin at birth helps both the mother and the baby recover from the stress of the birth, but we also see it in play throughout children and babies' lives. If the baby cries, the initial reaction is to pick the baby up and give them a cuddle to help settle them, and that's because part of it is because the oxytocin is helping to calm their nervous system, but it also helps them kind of forget if they were having a difficult time. And we do this with our children as they get older as well. You know, the 5-year-old falls over and cuts his knee, and you scoop them up and they give them a cuddle, and if they're really, really struggling, you get more in and give them even a deeper cuddle that's cheek and the nuzzling in, and we're getting some skin to skin contact in there, helping to negate against a negative thing that might have happened, and just helping to boost it up for everyone. But oxytocin as well, it isn't just a female hormone. So it used to be called the mothering hormone, and we now talk about it as the love hormone, and it's present in all people. And so we can use it to have a positive experience for all parents. So if we can encourage not just the birthing parent or the lactating parent to have skin to skin, but also the other parent or the father to spend a lot of time skin to skin, as we can see from the things that I've just spoken about, it's going to help those relationships. It's going to help bring the baby and the parent and the caregiver together, and it helps them understand each other more. So they found that the more skin to skin time a baby and a parent have, the more the parent understands the baby's social cues, the more the baby responds to the parent's social cues, and they have this lovely reciprocal relationship that can happen with any caregiver. It doesn't just have to be the breastfeeding parent. So I feel that possibly as birth workers, as midwives, as anyone supporting pregnant and birthing and postnatal people, that one of the easiest things we could do in our busy services that we work in is that if we can give parents the time, the space, or inform parents to spend as much time skin to skin as possible, that could have such an impact on breastfeeding, attachment, responsive parenting, and that it's not just for the just born baby, it's not just the golden hour, but it's for all of the newborn period and beyond. And as a lactation consultant, one of the first solutions we give when there's a breastfeeding problem is to spend time skin to skin. Let's get those innate reactions going back up. Let's start with the basics, and skin to skin is just one of those basics. Thank you for that. If I could talk about skin to skin and breastfeeding all day, so if anyone would like to contact me and have chats further, my information is there and will be on the slide.
Thanks for watching this video from the Maternity and Midwifery Forum. For more expert opinion and analysis, hit the button below to subscribe.